Good afternoon to everyone, and my pleasure also to share some of the work that we are working on the climate change and health, especially in the Pacific context. Part of my presentation has been covered by Moses and a couple of other colleagues, so reduce the time that I can probably I can focus on something else. This is the picture of the young children in the Kiribati. And this is where we work on that. These are the people that will be, I don't know, the vulnerability and the situation in 50 or 60 years in times. So, and this is the vision that we look for, not now, but more with the future generation. Now, this is the WHO. WHO is divided into six regions, and we have one in the Western Pacific, a huge geographical distribution from China, about 1.3 billion people, to something like, I don't know, what's the population of Tuvalu? It could be like 15, 20,000, could be less than that. Many different time zones, from well-developed countries like Japan and Korea and China to least developed countries at the same time. And specific sub-region like the Mekong countries like Cambodia, Laos, and Thailand, it has one sub-region there, a bit of China, and then a huge number in the Pacific. And this is where you're talking about diversity, vulnerability. You can get it from the Western Pacific region at the same time. And there are also some territories. I mean, these are the areas, and it's belong to to US and Britain and also to French. Next year, Pacific Health Ministers will be held at the French Polynesia. So it will be in the French language, so looking forward to see you in French Polynesia. Now, I start with this, with the fact that what shape health? I mean, what are factors affecting health? And we know that although a lot of resources go into hospital and treatment, but we are talking about a quarter and probably more of the health outcomes is related to the environment. So whether climate change is part of the environment or not, but we are talking about climate change exacerbate, that means making things worse. So these are from the water, bad water, very poor sanitation, chemicals introduced. Moses is talking about Shigitara, the food poison in fish is becoming worse and worse. So, and then the behavior, these are the factors. But if you factor in behavior and environment, it can be 40-50% contributed to the health outcome. And it's very important where we come from. Although resources go to the healthcare, but most of the outcome goes to the other factors. So this is a huge, what do you call it, the dichotomy or the discussion between the two, the public health prevention and also the treatment part. It's very crucial when we understand climate, the importance of the interface between ecology, climate, and health in the Pacific. You cannot talk about health if you neglect ecology. But the ecology is very affected by how the environment and the climate is changing. So Pacific island countries are among the most vulnerable to climate change, no doubt about it. And what happened is that it affects the ecological fragility. The ecology will be affected, eventually the health itself. So there was a professor at Harvard saying that health is the human face of climate change, and this is very true in the context of the Pacific. Now, I think Moses has shown about what are the factors that are vulnerable, what are the health outcomes vulnerable to climate change. There was a publication that was done 2 or 3 years back. I think Rocco was one of the main contributors to this craze, was around and contributed to this. So we have 2 or 3 publications, and you want to give it to the East West Center, your library. We want to bring back, but you can ask me if you need some of the copies of the publication. But the issue is that some are direct, which is probably related to disaster and the extreme weather, but some are indirect, and this makes more complicated. As one John mentioned about why it's been neglected, because the issue is about not so direct. You know, like if you look into incidents between climate change and diarrhea, it's not like a straight line curve. it is not so straight because there are multiple factors that are affecting health. So then the health professionals say, yeah, but we need more evidence, but until when? These are there's always been a never-ending discussion about, but the health is always been neglected. This book also summarized what are, and we did a kind of vulnerability assessment of 14 countries, like from Cook Island to Fiji, Kiribati, Marshall Island, like to Vanuatu, and small island like Tuvalu, and has identified what are the direct effects of climate change and the indirect at the same time. This provides a good foundation for us to move on. So, meaning good foundation mean to the Pacific countries, as what Amy was telling, that it is quite enough for us to say that the importance of it is, the next discussion is that what's next? What will be the action plan? How can we involve? How can we get the other sectors involved with the health sectors? So almost like enough, pretty enough with the kind of work, that the groundwork, that we move on with the kind of action plan. You know how bad the susceptibility of Pacific Island to sea level rise can be extreme, like Tuvalu. In Tuvalu, I was there, like the Tuvalu Minister of Health saying that for you to understand climate change health, come to Tuvalu. Because there was one stretch in Tuvalu, the distance between one line of the coast to the other line of the coast is between myself and that wall. It could be shorter. So meaning that if there is any sea level rise or sea surge from one side, the whole thing will be washed to the other side of the island. That's how vulnerable. But you're talking about half of those Pacific Island countries are vulnerable to sea level rise. And there was some studies being done about worries index, and you're talking about 4 or 5 of the Pacific Island countries belongs to the top 15. It's top 15 for not in football or not in soccer, but top 15 in terms of the risk to vulnerabilities, the capacity, the adaptability. There are, I think, a couple of indicators that come up with the index, but you're talking about few countries in the Pacific are among the worst in terms of the risk. So there was some discussion about what's next. And this is where I think you were talking about the health system itself. So how can we integrate the discussion about climate change in the entire health system discussion without saying that this is climate, this is not climate. So can we have, like, in 10 years in time, that the Secretary of Health, the Ministers of Health will talk about health, but bear in mind that the health outcome of the health discussion is already addressing the climate discussion. And that's the whole thing about, they call it the integrating the climate change into the health systems discussion. And there was some additional components with regard to the climate part, the normal 6 block of the climate, the health systems, plus additional. But you're talking about strengthening the health system by streamlining. We are talking about whatever, the service, the information, the human resource, and so on and so forth. You're talking already in the context of climate change discussion. That's the whole issue. And this is where we look into, for example, like the strengthening of the surveillance, and also to make sure that the health services sectors are also strengthened. Now, this is the roadmap. We are here, today, I think like today or yesterday, today is Monday, yeah, because we have 2 different zones. The World Health Assembly in Geneva is discussing about this climate change issue. Environment, health, and climate change. The Pacific ministers are gathering together among them to launch the SIDS action plan in the Pacific. Now, in Geneva. But let me go through with the historical or the roadmaps towards that. The discussion about this climate change and health was probably far behind, probably 2005. But in the Pacific, Moses was telling about, there was already a meeting the year 2000. It was in Samoa. A first workshop organized by WHO, and then a few countries get together. And the Pacific Health ministers met every 2 years on Pacific Health ministers. And they have the first one was 1995. It was reviewed in 2015. 2017, it was a discussion at the Cook Island, Rarotonga. And that was the discussion in Cook Island that saying that we want a stronger and bigger action and faster action on climate change and health in SIDS, in small island developing states. So these are the outcomes of the various meetings at the Pacific ministers, but these are the main targets or probably milestone that we have done so far, all toward small island developing states. Now, 2 months ago, we brought together about 18, 20 countries in the Pacific, bringing the health sectors and the climate change people. That means these are the NDA. The NDA, that means the National Designated Authority official of the country, bringing them together and discuss about climate change and health. We provide them some ideas about what should be the next move. They came together and come up with a quite specific and quite comprehensive action plan for the Pacific. Now, what I want to highlight is the fact that among the participants, the health sectors people, they are very ready, and then probably they are alert. But what is more important is the fact that the non-health sectors, the climate change people, are also equally supportive. These are the ones who went to the front saying that this is about time for you all, for the health and climate change has to move forward. So having them in the meeting make the entire meeting so powerful, and probably to me is very useful. And then there's a discussion about the need for urgent action to finalize the action plan through a fast-track process. And then hopefully that the action plan should be endorsed in the World Health Assembly now happening in Geneva. And then how to develop strategies to strengthen cooperation among SIDS. So team was there, and then most of us, or many of us are there, and then I think Moses, one of the pictures is about you. And then this week is the official, hopefully the official launching of the action plan on climate change. And what are they? The whole idea is by 2030, all health systems in SIDS in the Pacific will be resilient to climate variability and climate change. That's the vision itself, which focus on 4 areas. One is, how can we improve the health sector's participation, involvement in the governance process of climate change discussion in the country? Because climate change is not, the health sector is not the leading sector. It is led by another sector. It could be environment, it could be climate change, like Climate Change Ministry in Vanuatu. Further. They have their own Ministry of Climate Change. But how can we bring the health sector into the discussion itself, in COP23, in COP24, and so on, COP discussion and other discussion itself. The second one is about evidence. It's about identifying priority, investment, and monitor. What will be the worth for us to invest on? Then the third one is about implementation, preparedness for climate risk, health promoting mitigating policies. This is about early warning system, health services, and so on, with regard to climate change. And finally, it's about resources, about money, increasing investment on climate. So on empowerment, is the whole idea the action plan ensure that health argument is effectively incorporated into regional and global discussion, or sub-regional discussion. On evidence is enhanced capacity of countries in the Pacific to undertake research, or probably evidence-based intervention, for evidence-based interventions. For example, like this. This is what, before this I was in Cambodia, this is what we work with our colleagues, Catherine and Chris. This is interesting, to look into probably the trend between dengue and the climate factors further. Then the implementation strengthened the role of the health sector in promoting health co-benefits for climate mitigation actions and the implementation process. This is what we had done for the Philippines, to identify what are the healthcare facilities that are most vulnerable. This is the risk index, Virginia, and this is about both in terms of hazard assessment, in terms of storm surge, of landslide, in flood. Can we do that in the context of the Pacific? And then on the resource. So because we know that when it comes to resource, we had just launched a comprehensive study we just finished, but still preliminary, it's about 2% of the budget that goes directly to the health sector. And if you go further, it could be less. So the total amount of financial resources that goes to climate change in the Pacific, 2016 is about $1 billion. So about 2%. But when I go to Solomon, for example, or if we go to some countries, then it could be less than 23 million per year in that context. So once this is ready, we'll be able to share with you the mapping of resources on climate change and health in our region. And probably one of the final, my slide, as Lester was saying, I have 5 minutes. We have the climate change and health work in 4 countries: Kiribati, Solomon, Tuvalu, and Vanuatu. The amount is about 17.8 million, but WHO is not accredited agency. So we are submitting this through UNDP, which is an accredited agency of JEF, but focusing on 4 components of the health systems. So meaning that strengthening the health systems in the 4 countries by integrating with the climate systems components. And these are the these are the areas that we want to focus on in these studies. It could be, there are also some emerging issues. It's going to be a 5 years project, hopefully going to launch it 2019, hopefully, for 5 years. And we are looking forward to have probably a wider Pacific countries discussion about how can we get in more funding. Because as I said just now this morning, Cook Island has managed to get 10 million to support the health sector. And we are working with Marshall Island and a few other countries on this. So this is my presentation. Hopefully that these are useful to our meeting here. Thank you.